So we are talking about the radial nerve. Radial nerve is a branch of the posterior cord, rather it is continuation of the posterior cord. So formed by the union of all the posterior divisions, so supplies the extensor muscles. Its course is as follows. In the axilla, it lies behind the third part of axillary artery. Then it leaves axilla by passing through the lower triangular space along with profunda brachii. Then it passes through the radial groove which lies between the lateral and medial head of the triceps. Then it comes to the cubital fossa. So you can draw a diagram of cubital fossa. In the cubital fossa, median nerve is on the most medial side and radial nerve is on the lateral side. And there is brachial artery and tendon of biceps brachii. So this also one diagram you can add. So 4 diagrams you can draw for the radial nerve. Then it reaches as a lateralmost structure of cubital fossa, and then like Reliance Industries, it splits into 2. One, posterior introosseous nerve is the major branch supplying the muscles of the forearm, extensor muscles, and it continues, that is Mukesh Ambani, and it continues down as radial nerve, thin radial nerve, naam ke liye, that is Anil Ambani. So now we are talking about the branches of the radial nerve. The branches of the radial nerve, before entering the radial groove, it supplies the long and medial head of triceps, and it gives posterior cutaneous nerve. In the radial groove, it supplies branches to the lateral and medial head. Nerve to medial head also supplies anconeus, and it gives posterior cutaneous nerve of forearm and lower lateral cutaneous nerve of arm. After coming out to the radial nerve, it supplies brachialis, which is also supplied by musculocutaneous nerve, a hybrid muscle. Brachioradialis and extensor carpi radialis longus. Its articular branches go to elbow joint. Its vascular branches go to profunda brachii artery. The applied anatomy, the radial nerve, because it supplies the extensor muscles, if it is damaged, the extensors are damaged, flexors become overactive, and it leads to a condition called as wrist drop. This wrist drop happens in Saturday night party, when in the Western world people drink on Saturday nights and they lie like this. अपने यहाँ पे तो बसते पे ही, अपने यहाँ पे नहीं होता सैटरडे पे, वो लोग कुर्सी में भी बैठ जाते थे. Crutch paralysis because of use of crutch, or injection in the triceps which is given and damages the radial nerve. It can lead to condition called as wrist drop. Thank you so much.